Alright, so we're trying to actually move to the next category or classification of what abnormalities in the gastrointestinal system, and this is what the congenital abnormalities of the gastrointestinal system. So for the congenital abnormalities of the gastrointestinal system, I'm basically trying to look at what are the inherited medical conditions that they can born you and you can inherit, and basically the issue is in the gastrointestinal tract. So let's look at it. We said that congenital abnormalities of the gastrointestinal system, they are structural or functional issues and they are present at birth. That means the person actually inherited it from birth. So it could be intestinal obstructions, could be feeding difficulties, could be abnormal organ development. Okay, so what are the types of congenital GI abnormalities? The first on the map is you have esophageal atresia. So esophageal atresia could be as a result of tracheoesophageal fistulas. So they are basically narrowing the esophagus. So I'm just going to highlight all of them. Later on we'll talk about them in depth. Then we have the gastric and duodenal abnormalities, like you can have the pyloric stenosis, where there's hypertrophy of the pyloric muscle. So this could basically compress that part of the gastrointestinal tract too. Then the atresia could be at the duodenal, or there could be stenosis, where there's kind of like blockage, you understand. So small intestinal abnormalities, you have things like the jejunal ileal atresia. Then you also have malrotation with volvulus. Okay. So large intestinal abnormalities, you have things like the Hirschsprung's disease. So there's failure to pass meconium, which is the first two. There's abdominal distension, and you can also have chronic constipation. Okay. So abdominal wall defect, this is where you have the gastrocystis and the omphalocele coming in, which omphalocele having like a covering, while gastrocystis, the intestines, is just out like that. Okay, so other defects include the Meckel's diverticulum and the congenital diaphragmatic hernia. So this is just an introductory video to them. We'll come back and discuss all of them one by one.